Hello everyone, welcome to my YouTube channel. My name is Rosalind Kibaso. I'm a master's student at Moi University. Today we are going to discuss about postpartum psychosis. What is postpartum psychosis, or rather postpartum blues? Postpartum psychosis is a mental condition which is serious that occurs immediately after delivery within 2 weeks to 12 weeks. What are the signs and symptoms of a patient suffering from postpartum psychosis? These are the kind of patients who will be detached from their babies. They will have hallucinations, that is, they will hear things that are not in existence. They are going to be very paranoia, which means they're going to be suspicious of the surrounding and everyone who is around them. Lack of sleep or insomnia. And as we've said earlier, they're going to be detached from their babies, especially when it comes to breastfeeding. We want to look at the predisposing factors to postpartum psychosis. If a patient has had a mental condition prior to pregnancy, she is highly predisposed to having postpartum psychosis. Again, if there's history of psychosis within the family, again, it predisposes the patient to a higher risk of experiencing postpartum psychosis. Again, for patients who are already psychotic before pregnancy and stop their medication along pregnancy, are highly predisposed to having postpartum psychosis. So it is therefore important for you to inform your doctor about your psychotic history before, during, and even after pregnancy, so that the doctor keeps an eye on the risk of having an episode of postpartum psychosis. So we want to look at how are we therefore going to manage our patients in case they suffer from postpartum psychosis. It is important for the caregivers, the partner, or rather the spouse, to be watchful of the moods, any mood change of these postpartum mothers, and report or rather seek medical attention immediately you notice a deviation from their normal mood. If you realize that the signs we have talked about are being exhibited on these patients, it's very important to seek immediate medical advice where in a hospital where the doctor or rather the psychiatrist will be involved in assessing these patients. How are we going to manage them in hospital? The psychiatrists will start these patients on medication. Those are antidepressants and mood stabilizers, depending on the assessment of the patient. So our role as the caregiver is to ensure that our patients adhere to the medication they have been prescribed to, so that we can control the illness. Or if they are not being started on medication, it's upon us to follow the requirement that have been prescribed by the doctor, so that we keep observing them for any changes and rather for any improvement, so that we keep track of their health. I hope we have learned something today about postpartum psychosis, and this is going to be important in managing our patients once they have delivered. Thank you very much for listening to me, and bye. Have a pleasant evening.